The termination part of hypnosis is neglected usually, and its importance is underestimated. Without an appropriate termination, the trance will be unwrapped. Let's continue this chapter by reviewing a myth about hypnosis. Some patients may stay in hypnosis state forever and never get out of it. That's only a myth. If you hypnotize the patient and leave the subject unattended, which is not a good idea, two things may happen. The patient may fall asleep, or the patient may get bored because of being left without any suggestion and opens his or her eyes. So the hypnosis becomes over. All the years I've been practicing hypnosis, I've just had one case having difficulty to arouse. I mistakenly hypnotized the patient with a histrionic personality disorder. I did not take enough time for history taking, and as a result of that, I missed the point that the patient had some histrionic traits. Despite the fact that there is no absolute contraindication to hypnotize patients with a personality disorder, it makes a perfect sense not to do so. We will discuss about the indications and contraindications of hypnosis later. In that experience, the patient was seeking attention through becoming stuck in hypnosis. In another word, the patient was playing with me. However, that experience was more time wasting rather than a concerning situation. An important note about termination is to return all the temporary changes to the previous status before awakening the subject. Sometimes it has a very important clinical significance. For example, in dentistry, a reasonably small amount of bleeding can prevent from dry socket or alveolar osteotitis. After the tooth extraction procedure, a clot is formed on the site to protect the alveolar bone beneath. That clot will facilitate and is a part of wound healing. Too much bleeding can wash out the clot and increase the risk of dry socket. On the other hand, no bleeding, coagulation problems, or too little bleeding can cause failure to develop the clot properly, and as a result of that, dry socket or alveolar osteotitis happens. If you stop bleeding during a dental procedure like tooth extraction using direct suggestions and forget to suggest to return it to as it was, you may potentially increase the risk of alveolar osteotitis. So you need to return any suggestion you make, like analgesia, muscle relaxation, etc. Tonality and the volume of your voice should be changing gradually while leading the hypnosis towards the end. The final suggestions will be about leaving the subject relaxed and happy for the rest of the day. My favorite way to terminate hypnosis is to count down. I count from 10 to 1, and with each number, you feel more alert, awake, and fresh. 9, alert, 8, awake, 7, fresh, and so on. And 1, you open your eyes and get back to the room. You can ask the subject to stay in hypnosis as long as he or she needs and then awakes. Sometimes this method is not practical due to time limitation. It's important to ask the subject to stay in waiting room for a while after hypnosis. They should not drive immediately. When the subject is awakened, you can see the sclera, which is still congested. In this stage, if you ask the subject to close the eyes and get back to hypnosis, the patient goes to deep hypnosis again. It's called fractionation. We have already discussed about the fractionation in deepening techniques. At the end of hypnosis, you may ask if there is any comment or question. I prefer to ask, how was your experience? Most of the time, the patients smile and describe their experiences. It's a great opportunity for you to listen to them. The therapeutic session is not over yet. First of all, their feedback informs you about their hypnotizability. If they are highly hypnotizable, you may figure out what type of hypnotizable they are, imaginative or dissociative. Rather than hypnotizability profile, you may get some information you were not able to get while the hypnosis was going on. For instance, the subject may give you some valuable information regarding what was experienced through age regression. Those information can modify or direct your therapeutic approach to the problem.